Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide an update on the state of the COVID-19 pandemic in the United States for the week of September 20th. As you know, the pandemic was reported first in late 2019. It hadn't really impacted the United States much as of early March, at least the total number of deaths, but then you see the numbers start to increase fairly quickly. This is every week. You'll see a growing number of deaths, such that as of this week, we've passed 200,000 deaths and almost 7 million confirmed cases, and a 4.7% increase in the past week. I always like to point out that COVID-19 is a significant pandemic for us in the United States. In any normal 8-month period, we'd expect about this many deaths from the 10 leading causes of death. And the 10 leading causes of death in the United States account for 3/4 of all of the deaths. And whereas COVID-19 this year, it would be solidly in third place, the third leading cause of death. But this week, I want to share another way of thinking about the impact of COVID-19. Here are the 25 most significant pandemics in recorded history. On the left are the years of the pandemic. In the middle is the cause or the presumed cause. And on the right are the total number of deaths. And there's COVID-19, the 24th worst recorded pandemic in world history in terms of total number of deaths. Now, you might look at that and say, well, okay, so it's 24th. Is that a significant problem or not? Well, when you think about 2,000 years of human history that are reflected in this chart, it's pretty significant. But there's even a more important way to see its significance. And that is if you look at the 3 pandemics that are still going on, tuberculosis, HIV/AIDS, and COVID-19, the total number of deaths are very different. 1 billion for tuberculosis, 32 million for HIV/AIDS, and slightly less than 1 million for COVID-19. But if you look at the number of years it's been active, you see that these are somewhat misleading numbers. And in any given year, 1.5 million people die of tuberculosis, about 1 million die from HIV/AIDS. And if you extrapolate what we've seen so far in 2020, we would expect about 1.25 million. So COVID-19 is having a pretty comparable impact as these 2 very significant pandemics. And the real question is, how long will it go on for? And that'll impact where it ends up being on this total list. If you look at new cases in the United States, it grew very slowly and then sort of came up and down. It seems to be leveling off or perhaps coming down slightly. I'm not a big fan of looking at cases because it's dependent on the number of tests. So if you look at deaths, the deaths started in the United States and late March, early April, grew very, very quickly, then seemed to come down, then seemed to go back up again, and now seems to be leveling off or perhaps coming down a little bit. It's important to remember that just as in the rest of the world, the U.S. isn't a single entity. The pandemic hasn't hit everywhere equally. There are states like New York, New Jersey, Massachusetts, and Connecticut where the total number of cases rose quite quickly early on and then seemed to be leveling off more or less. Conversely, there are states like Virginia where it hasn't grown as quickly, but it does appear to be slowing down a little bit. States like Tennessee that are still growing, and states like Florida that seem to be growing even faster. This is another way to look at it. This is week-to-week percent increase. So early in the pandemic, we saw almost 100% increase week-to-week. That is doubling the number of deaths. And it's come down pretty significantly, leveling off now in the low 3% range. That means each week there's 3% more deaths than there were the week before. If you look globally, across the entire United States, this is all of the deaths that occurred all the cases that have been reported in the U.S. And then these are the reported cases in the last 2 weeks. And you can see a pretty significant change there from what was a peri-urban disease now spreading out into the rural areas in the Midwest and the South especially. So we're in the midst of a evolving pandemic. Some parts of the country seem to be past the worst, but many other parts are not. So we need to continue to be vigilant and to deal with this as a significant pandemic that it is. There's a great deal more information about COVID-19 available on our College of Public Health website. If you go and click on this icon, it will take you to a variety of other videos. If you know anyone who'd like to be added to the mailing list, please let Jan Stork know at this email address or phone number. I'd like to thank Melissa White for updating this week's slides and Dara Young for editing, producing, and posting them. As always, if you have any questions or any concerns or any uncertainty about things that I've said, please contact me. I'd like to hear from you, and I'd be happy to try to address your questions. Thank you very much.